Internists occupy a unique role in healthcare. They are experts in a spectrum of diseases and complex illness, earning the moniker, the doctor's doctor. Internists use their vast knowledge, experience, and skill to identify the best possible treatment strategies, making them scientific puzzle solvers. They are proponents of extensive clinical research, evidence-based medicine, and continuing education, fueled by the commitment to provide high-value patient care that balances science and compassion. In 2023, the Philippine College of Physicians celebrates 70 years of excellence and service above game. Driven by passion, constancy of purpose, and prudence in internal medicine. Take part in the 53rd Annual Congress of the Philippine College of Physicians on May 7 to 10, 2023 at the Philippine International Convention Center. Together, let's revisit all that we've become and move toward all that we can be. The Philippine College of Physicians is unstoppable, implying the road to 70, taking you closer to its 53rd Annual Congress, month after month, on the third leg of its pre-convention series of activities. The PCP invites you to take part in the Universal Healthcare Summit, Understanding Strategies, Aligning Perspectives, on March 25, 2023. The country's finest internists are called to join forces in driving the importance of universal healthcare by gaining more knowledge and insights on its implications in the practice of internal medicine, real-world experience in the local setting, the internist role as a UHC healthcare provider, financial structures and obligations of various Philippine government groups, and the challenges behind UHC. The road to 70 is just around the corner. Be there for the Universal Healthcare Summit to advance your understanding of strategies and align with current perspectives. See you on March 25, 2023. The Philippine College of Physicians is unstoppable, implying the road to 70, taking you closer to its 53rd Annual Congress, month after month, on the third leg of its pre-convention series of activities. The PCP invites you to take part in the Universal Healthcare Summit, Understanding Strategies, Aligning Perspectives, on March 25, 2023. The country's finest internists are called to join forces in driving the importance of universal healthcare by gaining more knowledge and insights on its implications in the practice of internal medicine, real-world experience in the local setting, the internist role as a UHC healthcare provider, financial structures and obligations of various Philippine government groups, and the challenges behind UHC. The road to 70 is just around the corner. Be there for the Universal Healthcare Summit to advance your understanding of strategies and align with current perspectives. See you on March 25, 2023. The Philippine College of Physicians is unstoppable in plying the road to 70, taking you closer to its 53rd Annual Congress, month after month. On the third leg of its pre-convention series of activities, the PCP invites you to take part in the Universal Healthcare Summit, Understanding Strategies, Aligning Perspectives, on March 25, 2023. The country's finest internists are called to join forces in driving the importance of universal healthcare by gaining more knowledge and insights on its implications in the practice of internal medicine, real-world experience in the local setting, the internist role as a UHC healthcare provider, financial structures and obligations of various Philippine government groups, and the challenges behind UHC. The road to 70 is just around the corner. Be there for the Universal Healthcare Summit to advance your understanding of strategies and align with current perspectives. See you on March 25, 2023. Internists occupy a unique role in healthcare. They are experts in a spectrum of diseases and complex illness, earning the moniker, the doctor's doctor. Internists use their vast knowledge, experience, and skill to identify the best possible treatment strategies, making them scientific puzzle solvers. They are proponents of extensive clinical research, evidence-based medicine, and continuing education, fueled by the commitment to provide high-value patient care that balances science and compassion. In 2023, the Philippine College of Physicians celebrates 70 years of excellence and service above gain, driven by passion, constancy of purpose, and prudence in internal medicine. Take part in the 53rd Annual Congress of the Philippine College of Physicians on May 7 to 10, 2023 at the Philippine International Convention Center. Together, let's revisit all that we've become and move toward all that we can be. Internists occupy a unique role in healthcare. They are experts in a spectrum of diseases and complex illness, earning the moniker, the doctor's doctor. Internists use their vast knowledge, experience, and skill to identify the best possible treatment strategies, making them scientific puzzle solvers. They are proponents of extensive clinical research, evidence-based medicine, and continuing education, fueled by the commitment to provide high-value patient care that balances science and compassion. In 2023, the Philippine College of Physicians celebrates 70 years of excellence and service above gain, driven by passion, constancy of purpose, and prudence in internal medicine. Take part in the 53rd Annual Congress of the Philippine College of Physicians on May 7 to 10, 2023 at the Philippine International Convention Center. Together, let's revisit all that we've become and move toward all that we can be. The Philippine College of Physicians is unstoppable in plying the road to 70, taking you closer to its 53rd Annual Congress, month after month. On the third leg of its pre-convention series of activities, the PCP invites you to take part in the Universal Healthcare Summit, Understanding Strategies, Aligning Perspectives, on March 25, 2023. The country's finest internists are called to join forces in driving the importance of universal healthcare by gaining more knowledge and insights on its implications in the practice of internal medicine, real-world experience in the local setting, the internist role as a UHC healthcare provider, financial structures and obligations of various Philippine government groups, and the challenges behind UHC. The road to 70 is just around the corner. Be there for the Universal Healthcare Summit to advance your understanding of strategies and align with current perspectives. See you on March 25, 2023.
Let us put ourselves in the holy presence of our Lord. Our dearest Heavenly Father, thank you for making all things possible. We are grateful for all the blessings you are pouring upon each one of us, despite the challenges we are all currently facing. Thank you for blessing us today with the wonderful opportunity to meet virtually and learn together in the awesomely exciting webinar. May your blessings of wisdom and guidance be upon us, all through the sharing and impartation of knowledge and skills by our resource speakers, facilitators, and moderators. May all of us learn together, upgrade our competencies, and capacitate us to be the help in the development of our learners' lives and communities in the spirit of your love and generosity. May we now humbly commit every part of this webinar to you as we all bring you the glory, honor, and praises for your kingdom and holy name's sake. All this we pray in the precious name of our Lord and Savior Jesus Christ. Amen.
Through the dreadful darkness, we shall be the light and lead a path to wisdom. Our will to be our light to those in pain and suffering. We shall hear unity, the Philippine College of Physicians, we shall be hand in hand, building a stronger nation.
The Philippine College of Physicians, through the Committee on Media Communication and Health Forum, presents its bi-monthly lay forum to promote the advocacies and mission of the college and its component and affiliate societies. An avenue of accurate and up-to-date conversations with the media and the general public, with timely and diverse topics covering vital public health and medical information, straight from the experts. In a platform that is convenient, accessible, and highly engaging. Welcome to the PCP Health Forum.
Once again to the PCP Health Forum. This is Dr. Guinevere D. Agra from the Committee on Media and Communications of the Philippine College of Physicians. So for today, we have another session of our Health Forum. We will tackle the relevant issues that we need to learn from today. So as we all know, disasters like calamities, armed conflict, and even a pandemic would leave everyone scrambling for policies and solutions to deliver efficient health care and services to the public. It is not a common subject during med school, and not all training programs incorporate that into the curriculum. But physicians are still expected to show up during these critical times. So in the American Medical Association Code of Medical Ethics, the physicians, whether individually or collectively, are obliged to provide urgent medical care during disasters. Now, this obligation is upheld even when the physicians themselves are exposed to greater risks for their own safety and health. So the PCP would like to salute the men and women in healthcare who are always ready to heed the call to help during disasters, while also recognizing the need to educate and to train more physicians on how to be more efficient during these situations. So today we are blessed to have a speaker with us that will enlighten us on how we can help out the physician's role in disaster. But before that, let us welcome Dr. Angelito Benjamin Belen. He's a member of the Board of Regents of the Southern Luzon region of the Philippine College of Physicians to give us the welcome remarks.
Good day. Welcome to the webinar of the Philippine College of Physicians, Health Crisis Preparedness Management. Recently, our generation has been challenged by volcanic eruptions, a viral pandemic, a series of typhoons, floodings, and landslides, arsenic contamination of our water aquifers, and even an oil spill in Mindoro, not to mention the numerous earthquakes in various parts of the country. And God forbid, we even face the possibility of a nuclear war. Hopefully, it will not happen. I would like to congratulate our speaker, Dr. Kenneth Koo, the current chair of the Committee on Health Crisis Preparedness Management of the Philippine College of Physicians. I am looking forward to a very informative lecture and a lively discussion to follow. My colleagues, see you on May 70th Annual Congress of the PCP. Thank you very much.
Parang na-overwhelm ako sa dami ng pinagdadaan natin, and he reminded us about an impending nuclear war. But I hope we will all pray together to have a safe 2023 onwards. Now, without further ado, let us introduce our speaker. He is actually an internist and a nephrologist, also a degree holder in hospital administration. He's an experienced crisis manager. No, he's the national chair of the National Crisis Preparedness and Management. He's also the medical director of the Holy Child Hospital and medical director and head of operations of Oriental Negros Unit Commander 551 Technical Administration Service. He's a chapter commander of the Knights of Rizal, Dumaguete City chapter. He's a member of the IATF on emerging infectious diseases for Negros Oriental and Dumaguete City. He's also a visiting member of the Regional Disaster Risk Reduction and Management Council, and also a member of the Council of CPR of the PHA, and also a member of the International Society of Nephrology. So Dr. Koo is a highly qualified and highly respectable resource person for this particular topic, which is the role of the physicians in disaster preparedness and management. Dr. Koo, welcome to the PCP Media Forum.
Thank you very much. Can I share my slide now? So good morning, everybody. So I'm here to speak on the role of physicians in disaster preparedness and management. So this lecture is from the Crisis Preparedness and Management Committee and the Committee on Climate Change, Environment, and Health. So both committees are interlocked with each other. So if we do not prepare for climate change, we surely would have disasters. So that is why these two committees are Magnolia Valley. So this is our logo, and this is my disclosures. I'm a clinical internist and nephrologist. I'm also a member of the Armed Forces of the Philippines Reserve Command under the 5th Technical Administrative Service Visayas Brigade. So I'm the unit commander of the 505th 1st Technical Administrative Service Unit in Negros Oriental. And I'm also a medical director of the One Rescue EMS since 2008. And I am not a disaster medicine specialist. So I'm just a clinical internist and nephrologist and practicing as a EMS practitioner in Negros Oriental. So the outline of my lecture is the physician's role in disaster response, the code of ethics, which I will discuss the World Medical Association, or PMA, and the American Medical Association Code of Ethics. Then we'll handle a very short disaster management cycle and discuss something about disaster medicine, and we'll give you an insight on the emergency management cycle of the British of Columbia and give you the summary. So this is our physician's role in disaster response. So the physician's role in disaster response, there are 7 things that can help you prepare for the next emergency. Number 1, we have to remember our ethical commitments. Then take an emergency response training course and build relationships with local agencies. Plan ahead and embrace your leadership role as a disaster response practitioner, and make sure your own family is prepared and register for disaster relief organizations. So I will discuss first number 1. So remember your ethical commitments. So disaster relief can present a complex ethical situation for individual physicians, and doctors have an obligation to provide critical medical care while also weighing the risk of providing care in moments in the moment versus being able to provide care in the future. After all, disaster relief can put physicians' safety and health and sometimes even their lives in danger. So these are the codes of ethics that I have uh, researched on. So this is our PMA Code of Ethics. So these are the general principles of the Code of Ethics of the Philippine Medical Association. This is 2019. And we can see here that there's no mention of emergencies. In the World Medical Association Code of Ethics, general principle number 11 states that the physician should provide help in medical emergencies while considering the physician's own safety and competence and the availability of other viable options for care. This is the American Medical Association Principles of Medical Ethics, which is 9 in all, and this is their Code of Ethics, 8-3, Section 8-3, which states the obvious fact that physicians' responsibilities in disaster response and preparedness. So, in summary, this is the Code of Ethics of the American Medical Association. Individual physicians have an obligation to provide urgent medical care during disaster. This obligation holds even in the face of greater than usual risk to physicians' own safety, health, or life. However, physicians' workforce is not an unlimited resource. Therefore, physicians also have the obligations to evaluate the risks of providing care to individual patients versus the need to be available to provide care in the future. Likewise, with respect to disaster, whether natural or man-made, individual physicians should take appropriate advance measure, including acquiring and maintaining appropriate knowledge and skills to ensure that they are able to provide medical services when needed, and provide medical expertise and work with others to develop public health policies and advocate for and participate in ethically sound research to inform policy decisions. So number 2 is take an emergency response training course. Number 3, build relationship with local agencies, plan ahead, and embrace your leadership role, and make sure your own family is prepared, and register for disaster relief organizations. So take an emergency response training course. Your hospital will likely provide disaster response training, and other seminars and workshops may also be available locally. So usually in the Philippines, we get our disaster response training with a local disaster risk reduction management council or office. So every time the LGU will invite doctors to join into with the incident command systems so that the private practitioners can also know how to do ICS in the future. There's also training available from international and national organizations such as the American Board of Disaster Medicine. And through the American Board of Physicians Specialty offers disaster medicine certification and recertification to physicians of many different specialties and backgrounds. So the disaster medicine is already a specialty board in America. And build relationships with local agencies. So if you live in an area prone to floods or hurricanes, tornadoes, earthquakes, wildfires, and other natural disasters, it's a good idea to build relationship with your local agency. So you know what their plan is in a crisis and who to call. So this is the most important part in our lives as a physician. So as a Philippine College of Physicians, we have to build relationship with our LGUs. And these agencies may also be able to assist you in updating your hospital's emergency contingency plan so you can work together. And even if you're lucky enough to live in an area that doesn't get a lot of natural disaster, you should still get to know your local agencies in case of a situation such as an active shooter, which can occur no matter where you live. So it happened already in Negros Oriental. So even New York has a news footage of what happened last 2 weeks ago. and it happened in our hospital. So plan ahead. So don't wait until a disaster strikes and then grab your medical bag and try to react in the moment. You should have a plan in case of a disaster at a personal, family, and institutional level. And for example, if a flood strikes your area, you should know how to keep yourself safe, where your family will evacuate to, and what your hospital will do in time of crisis. So embrace your leadership role. So in some cases, you may be directly responsible for helping your facility to prepare for and respond to disaster. For example, if you serve as an emergency physician in addition to acting as the chief of hospital operations. And in other situations, you may not have a direct leadership role when it comes to disaster relief. Even so, in emergencies, people naturally look to physicians for leadership. And your nurses, techs, and other medical personnel will definitely be looking to you to lead, and so may ordinary citizens and bystanders. So clear-minded decisions by an authority figure can make a difference in a disaster. So rather than resisting this role, we have to embrace it and prepare for it as much as possible. And make sure your own family is prepared. So you won't be able to care for patients in a crisis very well if you're worried about your loved one. So talk with your spouse, partner, children, and anyone you're responsible for to come up with a plan in the case of common disaster. So these are the following questions that you have to talk with your family members. So how will you communicate with each other? What will you do for the food? If you need to evacuate suddenly, where will you meet up? And do you have a backup in case of power goes out? And your emergency plan should be customized to the natural disaster most likely to affect your area. So the disasters really is more on personalized or customized depending on the risk of your locality, and registered for disaster relief organizations. So if you're really passionate about disaster relief, you can be proactive and volunteer for one of several organizations that help mobilize doctors, nurses, and other medical personnel to travel to disaster areas. And the American Red Cross is perhaps, or the Philippine Red Cross is perhaps the best known organization. But there's also Doctors Without Borders, the Emergency System for Advanced Registration of Volunteer Health Personnel, professionals, the Medical Reserve Corps, which I'm a member of the Armed Forces of the Philippine Reserve Corps, Medical Reserve Corps, the Human Rights International and Registered Nurse Response Network, and many more. So many of these organizations require you to complete additional training before you can be mobilized. But if you're really passionate about disaster relief, it's a great way to make a difference and truly save lives. So when it comes to a disaster, you can't just throw on your scrubs and rush to the scene. Preparing in advance and having an emergency plan in place will maximize your chances of keeping yourself safe and treating as many patients as possible. And for these 7 steps, you make sure you're ready as a physician, as an individual, in case you ever face a disaster. So this is our physician's role in disaster response. So there are 7 steps to be prepared for this disaster response. So I will now tackle on the disaster risk management cycle. So this is the common, or we already see this one, the disaster risk management cycle. So there's the pre-disaster risk, the disaster response, and the post-response. So this is another comprehensive emergency management. This is the 4 phases of the disaster cycle. So there's preparation in the right hand. This is the preparation, the response, recovery, and mitigation. So before everything else, we mitigate. So we study before what happened in our community, then we prepare. Then once the disaster comes in, we give our response and the recovery. So this is where our role are. So in preparation, we can help the community assess the needs and risks and capabilities, especially in the health management preparation. So what are the diseases that will come if there's flood, if there's typhoon? In the response, we can actively help in the emergency medical care. But the rescuing, really, we give it to the rescuers. So we do not go in the front lines to rescue people. We are at the back helping the medical side of those who have been rescued. In the recovery, this is the long-term needs projection, the health maintenance, and lastly, the mitigation is we have to study the vulnerability analysis and what we can do in the future disasters. So these are the four where we have roles in the four parts of the disaster management cycle. So this is another diagram by the FEMA. This is the disaster recovery continuum. So this is preparedness. This is actual short-term or days in the response, intermediate response, and the long-term response. So according to the Field Handbook for Early Rehabilitation Conflicts and Disasters, the responsibility of rehabilitation professionals in the initial response may include early rehabilitation for those with injuries or illness, assess, advise fit and proper assisted devices with training on use and maintenance, rapidly discharge patient of existing stable patients to free up bed space patients, for patients, for incoming acute patients and others. So I will now tackle on disaster medicine. So disaster medicine is the area of medical specialization serving the dual areas of providing healthcare to disaster survivors and providing medically related disaster preparation, disaster planning, disaster response, and disaster recovery leadership throughout the disaster life cycle or the disaster risk management cycle. So a disaster medicine specialist is to provide insight, guidance, expertise on the principles and practice of medicine, both in the disaster impact area and healthcare evacuation receiving facilities, to emergency management professionals, hospitals, healthcare facilities, and communities. And he is the liaison between and partner to the medical contingency planner, the emergency management professionals, the incident command system government, the incident command system, the government, and policymaker. And it is unique among the medical specialists is that unlike all other areas of specialization, the disaster medicine specialist does not practice the full scope of the specialty every day, but only in emergencies, and hopes to never practice the full scope of skills required for board certification, and engage in the development and modification of public and private policy, legislation, disaster planning, and disaster recovery. So this is the timeline of the disaster medicine. So in 1962, the NATO, the North Atlantic Treaty Organization, publishes the official disaster medicine manual edited by Schaefer. And in 1984, the United States Public Health Service forms the first federal disaster medical response. In 1986, it creates the National Disaster Medical System. And in 1986, the Disaster Medical Response Discussion Group is created. And in 1989, the University of New Mexico creates the Center for Disaster Medicine, the first such medical center of excellence in the United States. And elsewhere in the world, similar centers are created at universities in London, Paris, Brussels, and Bordeaux. And in 1992, the largest disaster healthcare response to date was initiated. So this is a very new article which was published in May 16, 2022. It studies the duties of disaster medicine specialists to save suffering humans and environment with smart thinking, such as pre-disaster preparation, disaster planning, disaster response, and disaster recovery. So we could see here, this is the four parts of the disaster risk management cycle: the preparation, the disaster planning, the response, and recovery. So this is the table of the roles of the 10 top roles of disaster medicine specialists. So it is to identify and immediately manage serious and life-threatening situations in disaster, to care for and stabilize critically patients of all age groups, and can interpret diagnostic imaging and can apply pharmacologic knowledge. So these are the top 10 uh, roles of the disaster medicine specialist. These are the top 10 benefits of disaster medicine. So it aims to give students skills in planning and hospital incident command, skills in PPE, decontamination, and information management. And these are the top 10 relief organization for disaster health. So it is the United Nations Office for Disaster Risk Reduction, United Nations Disaster Assessment and Coordination, the World Health, American Red Cross, and the rest of the international disaster relief organizations. So again, this is the disaster management cycle. This is where we can put ourselves into. We can help as a committee or as a national organization. So preparation, in response, in recovery, and mitigation. So this is the emergency management cycle of the doctors of British Columbia. So in mitigation preparedness, they said they can help in the planning and preparing to deal with emergencies in advance to ensure communities and healthcare facilities are able to respond when one occurs, can help reduce health impact resulting from emergency. So physicians should be supported to participate in developing household emergency plans, business continuity plans, and community-based clinics and or hospital plans. So for preparation, the doctors, physicians can prevent interventions, can help prevent emergencies, reduce and the chance of them occurring or minimizing their effects, and hand washing education. So these are more on education and public health intervention, which we usually relegate to our municipal or city health officers. But we can help them if they need something else. And in response, we can respond during emergencies, including managing the immediate health impacts that may come as a result. So physicians play a critical role in providing care to patients during and immediately following emergencies at both the hospital and community levels. And recovering from emergencies includes seeking to restore a community back to its previous states. So this includes caring for patients with mental health and trauma issues resulting from emergencies. So Dr. Paula asked me to discuss about the Mindoro oil spill. So this is my last few slides. So we can manage the 2023 or the recent Mindoro oil spill. We can help, and these are our roles really. So in the mitigation, so I start first with mitigation. But honestly speaking, we have to start with response. So the disaster has came in. So there's an oil spill. So our response should be, we have to play a critical role in providing care to patients during and immediately following emergencies at both the hospital and community levels. So we look for toxicities of hydrocarbons. So what are the health problems that will be incurred during these oil spills? The containment of the spread of the oil spill is left to those who are experts on that. So that's why there's the US Coast Guard, the Japanese group is already helping us. The local fishermen are putting booms right now to prevent. But what we can do is we engage with the local government to talk to them what are the possible toxic effects of the hydrocarbons if people will eat the fish that has eaten the oil spill. And recovering from the long-term health effects of oil spills will include identify long-term diseases caused by the oil spill, coordinate with DNR when it is safe to eat seafoods in the area. And lastly, mitigation is to put in emergency plans, continuity plans, and other plans if there's another oil spill that will happen in the future. So in summary, these are the physician's role in disaster response. So 7 things that can help you prepare for the next emergency. Remember your ethical commitments. So first of all, we have to see if it's not harmful to us. So that's remember your ethical skill, because we are a rare breed. And take an emergency response training course, build relationship with local agencies, and plan ahead, and embrace your leadership role. Make sure your own family is prepared, and register for disaster relief, or you have to join with a local disaster relief organization in your area. So that's all for my lecture. So thank you very much.
Thank you so much, Dr. Ku. Madami tayong natutunan, no, tungkol sa disaster preparedness. I think the PCP, sir, would you like to invite them to join your committee? Sa mga people who are interested, the PCP has different committees that we can work together with, like sa amin sa media communications, but of course, your group can also work together and encourage other people to be trained in disaster preparedness. Meron po ba tayong mga training programs locally that can help equip our doctors?
Okay. Right now, we are planning to have a booth. I hope I can make one during the PCP annual. So we're planning to have CPM champions, or crisis preparedness and management champions. So I would like to invite everybody, to those who are interested, to join us so that we can teach you first the basics, which is ICS, Incident Command System, so that we will know where we put ourselves during a disaster. Because in an incident command system, we have to respect who the incident commander is. So usually, it has been taught that in a locality, the incident commander usually is the local LGU head, or the mayor, which has his own disaster risk reduction management head. So usually in a incident like that, we check in with the incident commander and ask him where we are placed to. But before that one, it's better that we go for the local, we communicate with the local agencies, so that it is very important we know what they are doing. Like in Dumaguete City, if there's an incoming disaster or typhoon, I am usually called and discuss what we can do in the line of health preparedness. So we're not there to help them in the rescuing. We're there in the health management. So I usually tell the local government that we're here to help them manage or predict what health problems that may occur in a disaster. So one rescue, or the Oriental Negros Emergency Rescue, is usually there, but we tell them that we are EMS, Emergency Medical Service. We will not fight with the rescuing part. So what we do is the EMS. So I hope that we can invite those who want to become incident commanders or CPM champions in the future, so that we can discuss this with your local group, especially in the local areas, and we can teach you how to risk stratify your area, so that we can prepare for your disasters in the future.
Yes, preparation is key. Sir, there's a question here. What is the PCP position on the medical reserve bill?
Okay, that's really a board decision. But for me, as a reservist, as a medical reserve corps, it's very when I entered the Armed Forces of the Philippines, the Armed Forces of the Philippines is very, very strict in accepting us. So there's they have to see your background first. And in the Medical Reserve Corps, uh, you will only be tapped if you volunteer for call to active duty. So it does not mean that if you are a medical corps in the Armed Forces Reserve Command, you will be pulled out in your office immediately anytime. No. You will be called up they will announce a call to active duty. And it depends upon you if you want to apply for the call to active duty. Once you apply for call to active duty, the armed forces owns you. So the armed forces will now assign you to any place in the Philippines where you will be assigned if you will apply for call to active duty. But if you will not apply for call to active duty, they will not. They will just invite you if you want to become one. Call to active duty. Okay, but in times of war, if you are a reserve, your armed forces reserve, you're a reservist, you will be called to active duty immediately in times of war. Okay, so like in Marawi, so the Marawi incident. So in the Marawi incident, since the war is in Marawi, those who are those reservists in Marawi are immediately called for active service. But those outside of Marawi, they are invited if they want to call to active duty. So once they are called to active duty, you will now be assigned anywhere. So we have two nurses in Cebu who are nurse corps who are now in Viluna working as active nurse corps because they applied last year. So the call for active duty, it depends upon the tour of duty. So it will range to 6 months to 3 years. So it depends upon what you sign. So it does not mean you apply for medical for reserve corps, you will be immediately be pulled out to active duty. No, you have to apply for it.
Okay. Meron pa pong mga tanong. There seems to be more frequent earthquakes. What should we in PCP do to prepare for the big one?
Okay, for the big one. So in my handbook, so there's the handbook that's the big one scenario. So we have to study that big one scenario, especially in Manila. So we have to teach our medical student, our family first. If where you are placed and where you will evacuate according to the National Disaster Risk Reduction evacuation plans. So that is the most important part. And we have to actively participate in the earthquake drills. So the earthquake drills is very, very important. So sometimes kasi binabaliwala lang natin. Tapos ang nangyayari, pag nandiyan na yung earthquake, bago tayo magsisisi. Unless it's different. Earthquake, we do not know when it will come. So that's why we have to practice the drills really. So we have to get a copy on that because the manual is with PCP already. So you can ask PCP if you can get the manual, and you can get the map for the evacuation is publicly available in the internet. So you can see that one, so then you will know where you will evacuate in times of the disaster. Okay.
I think maybe we can post the link to that resource material in the PCP website or in the PCP social media page so that people who are interested can easily access the document.
Yes.
Okay. Sir, what about the hospitals? Would the hospital administrators also have like a group that they participate in so that they can be prepared during disasters?
Fortunately, I'm the medical director of one hospital here in Negros Oriental. I'm the board treasurer of the other hospital where the governor was brought. So Unfortunately, we're just making that the protocol for a similar thing to happen. We hope it will not happen again, but we were shocked. We were not called. The other hospital was called, but the governor was brought to our hospital. So it was, they say it was a blessing in disguise because all the media was in the other hospital. So we were able to take care of the governor properly without the hindrances of the media people. But unfortunately, the governor passed away. But we tried to stop the bleeding of the governor. That's why he was immediately brought to the OR. We tried to stop the bleeding of the governor. Okay.
Okay.
So we would like to ask, I'm here available if the local government, the local PCP chapters, including their hospitals, would like to have a similar contingency plan for that active shooting. So it was really not a good incident. It was a war really in the Central Visayas, which we usually do not experience.
Okay.
So we just hope it will not happen again.
Okay. May mga questions pa po, sir, no? Dr. Ku, having seen many emergencies yourself, what do you think will be behaviors of Filipinos? Will it bring out the best or the worst?
The behavior. We hope it can, the behavior of the,
Hindi ko po
what
alam
behavior?
kung anong ibig niyang sabihin, but I guess in general, maybe what's the prevailing attitude of Filipinos during emergencies?
We hope that the younger generation really does not want. My concept or my experience is that kanya-kanya na kasi yung mga medyo younger. So we just hope that they will be more nationalistic or they would try to volunteer more. So we lack really volunteers to do this part. It's very depressing really because sometimes LGU, the LGU does not really invite us, especially other LGUs in the Philippines, that we will join them. So I'm very lucky in Negros Oriental, in Dumaguete City, that the mayor is, if he has health problems, he calls in anytime. It means anytime, 1 a.m., he calls me, especially in the COVID times. But that's part of our job, really. So we have to respond to what they're called, because once we do not respond, they will not call us anymore. So that's really a 24/7 work, disaster relief. So anytime the mayor calls, you have to go there. If you do not go there, the next time you will not call anymore. So that's really the sacrifice that we are in. So it's really a non-monetary job. Para ka ring residente na tinatawag anytime. But it's a bigger venue really, not the hospital, but the whole city or the whole province. So if you want to be like that, so hope we can see you, meet you, and we can help you really.
Yes, meron na pong mga gustong magpalista. Isa po si Nino Joselito Doidora. Paano po magpalista? I'm from Baybay, Leyte po.
He can message me or he can call Eliza, message Eliza so that we can contact you. And we can see you in the PCP annual so that I can talk to you.
Sige. Meron pa pong mga questions, no? How should we and IM be more active in mental health and address post-trauma stress conditions? Do you recommend IM doctors learn more about trauma, gunshot wounds to complement the surgeons?
Okay. We have to respect the specialty. So trauma, post-traumatic stress syndrome should go through the psychiatrist. So if you have more psychiatrists in your area, we delegate it to them. So we have to divide the work really. If there's no psychiatrist in the area, then somebody should take the brunt of the the work there for the gunshot wound trauma. So that's what we are trying to look for to the volunteers, to the persons who have experienced the actual, because one of my volunteers was the one beside the governor. So we're looking for any PTSD really. So right now, there are signs really, hindi natutulog na bukas ang close ang light sa gabi. So we're just trying to help him. So that's part of the recovery program. If we make it a micro area, so that incident really is a disaster. Really, the incident that happened in the town was the disaster. Then we're right now in the recovery phase. So we're just helping those who have survived with the recovery phase. So that's we make it a micro environment. The bigger picture, we make it a smaller picture, and we function. We work like the disaster management cycle, but in a smaller scale.
Okay. Ang daming na-spur na interest sa inyo, sir. Should PCP have a position on gun control in the country?
That's I am not in the position. I'm not PCP. So I'm just the chairman of the Crisis Preparedness Committee. So I hope that Kuya Lito can push for a gun control. But the position really is we have to look for both sides. Like in Negros Oriental, if you gun control the good gun owners, then the bad gun owners will have no gun control. So that's the issues really. So we have to talk about it properly in a different forum, and we hope that PCP can be there. But for me, really, in this lecture, PCP can make a position and hope that government can invite us as visitors. Like me, I'm a visitor of the Regional Disaster Risk Reduction Management. I'm telling them that I'm there to observe, not to be a voter. So I'm not there to change policies. I'm just there to observe and to give comments or to help them in the health management or health side of the disaster management cycle, the risk cycle. So we can give inputs to what they can do with the health side in the area of disaster cycle, disaster risk management cycle. So that's what we are aiming at right now.
Okay. Sir, sa Facebook po, no, marami din po bang, maari po bang gawing vernacular na layman's term yung nabanggit po ninyo, Doc? Maybe just the cycle of disaster response, maybe masimplify po natin ng konti so that our lay people can appreciate.
We will try our best to do that. So far, wala pa akong nakikitang vernacular sa disaster risk management cycle sa lahat na inatenan kong ICS, all English. So wala nga Tagalog eh. So it's a good idea. So we can ask somebody who is very fluent with the vernacular, especially Tagalog and Visayan language, so that we can make it into the vernacular para maintindihan naman sa lahat, especially the layman.
That's true. Kasi minsan naikot na lang sa atin na hindi natin na-communicate properly yung preparedness to others. Another comment. Good morning, Doc. Maybe you can also try to revisit the hospital preparedness for emergency training by the Asian Disaster Preparedness Center as part of the program for enhancement of emergency response. This training has been going on for many years in Asia. Are you aware of this, sir?
I'm not really aware with that, but I will try to look at it and check how we can update it in our responses in the Philippine hospital settings.
Okay. Meron pong website to dashtool.org. It has different modules on how hospitals can actually prepare their supplies for disasters or emergencies. Okay, meron pa po bang mga tanong? I think Dr. WHO has spurred a lot of interest. Hindi po natin madidiscuss lahat-lahat in totality for just an hour duration. But just to sum up, ang payo po ni Dr. Ku, unang-una tandaan natin yung ethical commitments natin that we are here to serve. And ideally, we would want to be prepared. So we should also take emergency response training course. Sana po maybe your committee can help prepare a short course for interested doctors. Connect with the local agencies, mga LGU, tsaka mga NGOs that are concerned with emergency response, and especially kahit mga typhoons, mga evacuation center. Plan, and embrace the role. No? Andyan na po tayo. This is what we signed up for. And I think during the pandemic, na talaga pong lahat ng internists or lahat ng doktor natutong tumayo and to really stand up for what we signed up for. But we should also prepare our families, no? Kailangan sa bahay natin meron din tayong emergency plan, and also connect with others para mas maayos po yung network natin. Kahit po si Dr. Ku na nasa Visayas, we should also have an interconnection sa Luzon, Visayas, Mindanao para po mabilis. And he mentioned the 4 major steps: mitigation, preparation, recovery, and response. They are interrelated. We'll try to send links to resources in our FB page or in our website para po makabasa po yung mga interested audience. And then there's another comment. Please recommend where to take emergency response training for medical personnel, sir.
I'm still looking for it. In Negros Oriental, we're training EMTs. Unfortunately, in the Philippines, the emergency medical service we have no laws for emergency medical services. That's why the National Disaster Risk Reduction Management Committee, our council, is the one training for EMS, for the TESDA, really. In Negros Oriental, One Rescue, or the Oriental Negros Emergency Rescue, is training volunteers. We are getting volunteers, high school graduates, to become emergency first responders, and they volunteer with us. We give them stipend. We have no money to give them sueldo, but we give them stipend for their volunteer work. Unfortunately, most of our volunteers right now are in abroad already, so they are being pirated also as EMRs there in the fund. And we have an EMT program under TESDA. We're planning to have another EMT program with Silliman University so that they can have their on-the-job training. And you can ask your LGUs if they are willing to train you to become EMS. As medical doctors, we are not there to become rescuers. We are EMS, emergency medical service providers. So we are not EMTs because we're higher than EMTs, emergency medical technician. So what I tell my volunteers, they are EMRs or responders and technicians. But me, I'm a practitioner of EMS. So I overview everybody. So we will contact. I hope I will know Dr. Francisco, so that we can ask their locality if they have training for medical emergency response for medical personnel. Because right now they're training volunteers for rescue. So you just email me or ask Eliza to PM me so that we can talk. We can communicate with each other so that we can ask if there's a response training, emergency response training for medical personnel in your locality.
Okay, mukhang PCP will eventually have this training course kasi ang dami po talagang interested. I think yes,
before
sir.
I forget, okay. ganito, being a EMS practitioner or a disaster responder is not 1 year, 2 years. So it's very difficult. That's why I'm proposing for my committee na you will become a champion so that it will be part of you as a doctor na you respond. So we just hope that not hindi lang 1 year to, hanggang 1 year pa tapos hindi na, ayaw ko na. So emergency response really is for life. That's why I'm there. I'm chair since 2015. And medyo nakakapagod pero interesting naman, lalo na last 2 weeks ago. It was very interesting for us here. And the oil spill is also interesting, but the gunshot wounds were more interesting for us here in the province. So we just hope na we can train medical personnel for emergency response at the higher level.
Okay, I think we need to close na for in the interest of time. All the interested individuals who messaged and commented, maglalagay po kami ng link sa FB page or sa website so that you can gather all resources. And we'll also put in the email of Dr. Ku if possible. To close the session, we will call on Dr. Danilo Baldemor. He's a member of the Board of Regents of the Northern Luzon region of the PCP.
Good morning. So, good morning everyone. So, nakakatuwa itong lecture ni Sir. So, I think marami tayong natutunan, and aside from the two organizations na nag-involve dito sa disaster management, maganda rin ma-involve natin yung ating mga PCP chapters to take also in consideration yung mga kailangan natin. Now, also as an ordinary citizen and as a physician, may tatlo akong bagay na natutunan sa ating disaster discussion. So number 1 is to be prepared. Number 2 is to be prepared. And number 3 is to be prepared. Everyone, on behalf of the PCP Board of Regents, salamat sa ating speaker kay Dr. Kenneth Ku, and to our moderator, Dr. Guinevere D. Agra, to our guest from the media, and to all the PCP fellows and members, and importantly, sa ating mga pasyente na nakikinig ngayon, to engage also in our community. And lastly, salamat din sa ating PCP staff for having this health forum. So see you again on our next activity of the PCP Health Forum by the Committee on Media Communications. Thank you very much.
Thank you, sir. And for some announcements, no, hindi po tayo natatapos na ang dami-daming activities ng PCP. So aside from the PCP Media Health Forum, we also have every Saturday, meron po tayong I Am Informed, PCP sa Radio Veritas. So it's aired via Radio Veritas and also in our Facebook page. So tuwing Saturday po yan, 9 to 10 a.m. So the topic for this week is about diabetes. Aside from that, as a pre-convention, we have discussions on universal health care. The ABCs of UHC is a webinar on March 22, Wednesday. And then on March 25, it's the UHC Summit as a pre-con event of the PCP 2023. And then, of course, for our 53rd annual convention, it's a 70th anniversary of the PCP, entitled Passion, Constancy of Purpose, and Prudence in Internal Medicine. It's the 53rd annual convention, May 7 to 10 at the PICC. So I hope you will mark down your calendars and take time to join us in all of these activities. And you will also see Dr. Ku in person. Baka pwede kayong sign up sa kanyang mga training programs. I think that's it, and see you again in the next PCP Health Forum and other PCP activities. Thank you so much for joining us today.
Thank you. Thank you.
The Philippine College of Physicians, through the Committee on Media Communication and Health Forum, wishes to thank its media partners, social media followers, and participants. See you again next time here on the PCP Health Forum. The Philippine College of Physicians is unstoppable in plying the road to 70, taking you closer to its 53rd Annual Congress, month after month, on the third leg of its pre-convention series of activities. The PCP invites you to take part in the Universal Healthcare Summit, Understanding Strategies, Aligning Perspectives, on March 25, 2023. The country's finest internists are called to join forces in driving the importance of universal healthcare by gaining more knowledge and insights on its implications in the practice of internal medicine, real-world experience in the local setting, the internist role as a UHC healthcare provider, financial structures and obligations of various Philippine government groups, and the challenges behind UHC. The road to 70 is just around the corner. Be there for the Universal Healthcare Summit to advance your understanding of strategies and align with current perspectives. See you on March 25, 2023.